Good morning, everyone. So, last class we discussed about hemoglobin. So, you know the hemoglobin mainly present in RBC, right? The hemoglobin is made up of a heme part and globin part. So, next is the types of hemoglobin. There are two types of hemoglobin: adult hemoglobin and fetal hemoglobin. In adult hemoglobin, there is a 2 alpha and 2 beta chains are present, and in fetal hemoglobin 2 alpha chain and 2 gamma chains are present. So fetal hemoglobin seen only in fetal life because the gamma chain, it has a greater affinity to oxygen. So mainly the hemoglobin combines with oxygen, so then it will carry it to the tissue. So this type of hemoglobin has a greater affinity to bind with oxygen. Next, coming to the disorders due to abnormal hemoglobin. Okay, disorders due to abnormal hemoglobin. So normally 2 alpha and 2 beta chains are present. If any changes in these polypeptide chain, so that will lead to a condition called thalassemia. Okay, called thalassemia. Thalassemia is due to deficient production of alpha or beta chain. Okay, so deficiency of means, so 2 alpha and 2 beta chain should present. If 1 alpha or 1 alpha with 2 beta chain or 2 alpha and 2 beta chain. So it is further divided into two types, major and minor. So thalassemia minor is more common. Okay. So thalassemia major is a total absence of beta chain. Okay. So in that condition, so beta chain is not present, only 2 alpha chains are present. Okay. 2 beta chains are absent. Then in thalassemia minor, there is a partial synthesis of beta chain. Okay, partial synthesis of beta chain. Understood? Disorders of abnormal hemoglobin. So one is thalassemia. So thalassemia is due to deficient production of alpha or beta chain. Next is the sickle cell anemia. Sickle cell. Here each polypeptide chain of hemoglobin A means in adult hemoglobin. Okay, in adult hemoglobin A means adult hemoglobin, there are polypeptide chains are present. So these polypeptide chains are what? Amino acids, right? So there is a amino acid glutamic acid at the position 6. The glutamic acid is replaced by valine. So very important. Okay, so in the sickle cell anemia, so in the polypeptide chains means, so these are like this protein chain. Okay, alpha and beta are the protein chain. At the position 6, at the position 6, the glutamic acid will be present. So proteins will be connected here. Okay, so in biochemistry we will come to know. So and they form a chain. Understood? Each one is a amino acids. So each one will connected each other and form a chain, polypeptide chain. We call it as a polypeptide chain. So like this. So here at the 6th position there is a glutamic acid is present. Okay, so glutamic acid is present. Suppose this is glutamic acid. So this glutamic acid is replaced by a protein called valine. Okay, replaced by valine. You have to remember, glutamic acid is replaced by valine. So that time what will happen? That will cause a sickle shape like this. Okay, the hemoglobin will be like this, sickle shape. So RBC will attain a shape of sickle shape. Understood? Sickle cell means because of the change in the amino acid sequence or glutamic acid is replaced by valine, the RBC usually it is biconcave shape, right? It is biconcave shape. So that is biconcave shape is replaced by a sickle shape. Okay. So this type of hemoglobin is having a low oxygen tension. So the hemoglobin get precipitate into elongated crystals. So it will precipitate inside the RBC. Now suppose this is RBC. Okay. So this is RBC. Here there is a changes will be taking place in the hemoglobin, right? Hemoglobin change. So that type the hemoglobin get precipitate inside the RBC. So if this one get precipitate, what will happen? The main function of hemoglobin to combine with oxygen, right? Hemoglobin combine with it get precipitate. So that will get precipitate. Okay. So because of the precipitation of hemoglobin inside the cell, so that will decrease the oxygen carrying capacity. Okay. Understood? Sickle cell anemia. Here the polypeptide chain, you know, right? Alpha and beta. So this is a normal RBC count, 6 to 7 million. In male it is 5 to 6 million. In female it is 4.5 to 5.5 millions. So next topic is let's complete the RBC. Let's complete the hemoglobin class. So next we will go see the erythrocyte sedimentation rate. In the erythrocyte sedimentation rate, it is a rate of downward descent of RBC in a vertical column of blood. So that means, when you take a blood in a pipette, okay, take a blood in a pipette. So and sometime if you keep it like a vertical column, okay, when you keep it as in a vertical column, a narrow pipette, so what will happen after some time? The RBC will settle down. Okay. So anticoagulated blood is allowed to stand vertically in a narrow tube. So what you have to do is you have to take the one tube. So put the blood, fill the blood in the tube and keep it for some time. Okay, keep it for some time. So what will happen after some time? So RBCs, okay, so because it is heavier, the RBCs will be settled down. Okay, so it will come down. If you fill up to here, so it will come down like this. Okay, so that means, so RBC will be settled down. Understood? So erythrocyte sedimentation rate is the rate at which erythrocytes settle down in a unit time in a narrow pipette. Okay. So when red blood cells are allowed to settle down, a clear column of plasma will be at the top part of the pipette. So I will show another diagram. It's not there. So what will happen if you keep the RBCs? So before that RBC will be like this, okay, fresh blood. So after some time, so it will be pile up. You can see the coin, okay. If you keep the coin like this, so one above the another, it will be pile up. Same like RBC will be piled up, okay. RBC will be piled up. That is called Rolax formation. Clear? Rolax formation. This Rolax formation is because of the formation of Rolax, the erythrocyte will be settled down. Clear? To take the narrow test tube, you have to fill the blood with anticoagulant, fill the blood. So usually in the lab they will check the ESR, okay, erythrocyte sedimentation rate, okay. That is one routine test they will do in the lab. So this is after 1 hour, okay. So if you keep like this after 1 hour, so what will happen? There is a clear plasma can be seen above, okay. So this is blood. So all the RBCs are piled up. It will form like this, okay. All the RBCs will be piled up. So the length of the plasma column, so whatever the plasma will be here, right. So plasma which is present here, suppose this is plasma. So this column you have to take as a measurement, okay. So just remember. So what is ESR? So ESR is a rate of downward descent of RBC in a vertical column of blood. That's all, okay. So next, why the RBC settled down? The reason, because the shape and number of red cells. The shape is biconcave disc and the number is more. So compared to other blood cells like leukocytes, WBC cells, it is only 1000 around it will come. But the RBC are in millions, okay. So next point is size of Rolax, okay. So that depends on Rolax formation, the piling up nature of the RBC. Then the presence of plasma proteins, okay. Presence of plasma proteins. So these are the reason. Next coming to this is one method how to do the ESR. So these things they won't ask, okay. So procedure and this is the how the Westergren tube of ESR. So you can see the picture. So this is the by Westergren method. So one method is there, that name is Westergren method to detect the ESR. So it's a vertical column of blood can be keep like this, okay. After 1 hour you have to check the ESR. So just you have to remember the normal. So what is ESR? Normal value, okay. So which method? So there are two methods you can see. So Westergren method is enough, okay. So normal in male after 1 hour, if you see there are 3 to 5 mm, okay. So 3 to 5 mm. In female after 1 hour 5 to 12, okay, 5 to 12 mm. Understood? 5 to 12 mm. Next come to clinical significance of ESR. So why we have to do ESR? So as I told, so when you go for a lab, so they will perform this test if any anemia or a blood checkup. So when you doing the complete blood checkup, they will see the RBC count, WBC count, platelet count, hemoglobin count, and ESR. Okay. So why we have to do ESR? So ESR is changed in a great variety of condition. In alteration is not specific and not diagnostic. That means, so this test will do in the diagnostic lab. It is not a specific, because that means it will not do it like for COVID-19. If you check for a test, so they will do only the COVID test, right, to check the presence of coronavirus. That is a specific test to check the COVID virus, right? COVID-19 test they will do to check the presence of coronavirus. But ESR will not give any disease. It will not give any name of the disease. It will they will only prognostic value. Prognosis means if you having anemia, decrease RBC count, you will go for a treatment. After some days your RBC count will increases. So before that they will check ESR. So that will ESR will give how fast your RBC count is increasing. Okay, so that is called prognostic of the disease. Clear? Prognostic of the disease. It will not give any diagnostic value. So that, and it detects the presence and severity of disease. Presence and severity of the disease, whether the anemia is a mild anemia, moderate, or a severe anemia. So like that, you get the idea about the activity of the disease. Okay, so in case of malaria, if any malaria, they will check the ESR. So ESR will be very high in malaria condition. Okay, so but when you do the ESR, it will not give a malaria test. Okay, it will not tell a disease of malaria. Understood? So that is diagnostic. So prognostic means, so whether you are taking the treatment or any medicine you are taking, whether it is working or not, whether your malaria fever is coming down or not, it will tell. So these are the clinical significance. Next come the factors that affect the ESR. So when you are telling the factors, you have to classify into two. One is the physiological factors, okay, and another one is a pathological factor. So physiological factor will be occur in everyone. Physiological means normal, okay, normally. The ESR is increased in newborns, okay, in newborns, in females, in pregnancy and menstruation, okay, newborns, in females and pregnancy and menstruation, the ESR will be high. Next, the pathological factors. Pathologically, the ESR is increased in acute inflammation as tonsillitis, okay, malignancy, chronic inflammation like TB, and rheumatic fever. ESR is decreased in polycythemia, sickle cell anemia, and hereditary spherocytosis. So any one condition, if you remember, is enough. Okay. So pathological condition, when it increase, when it decrease. Physiological condition, when it increase, you have to, any one or two condition, if you remember, is enough. Understood? So ESR is very important. So what and all you have to study is, what is ESR? Okay. It is the rate at which the erythrocytes settle down in unit time in a narrow pipette. Clear? It is the rate at which erythrocytes settle down in unit time in a narrow pipette. So here we are using the narrow pipette is Western grain pipette. So the name, the test is Western grain method. Understood? Western grain method. So why the RBC settle? The reason is, one is the shape and number of red blood cells, the shape is biconcave and number is high. Then size of the Rolax formation. So Rolax I already told. So it is one of the important property of the RBC. So when all the RBCs are come together, so it will pile up. Pile up means like a coin. If you keep a coin one above the other, so same like the RBC will be piled up. So that will form a Rolax. Next is the presence of plasma protein. So normal values you have to remember. Okay. So in male it is 3 to 5 mm in first hour, 1 hour. Then in female it is 5 to 12 mm in the first hour. So clinical significance. So means the ESR will be increased in many disease, and hence it does not have a much significance as far as diagnosis of disease is concerned. So that means understood, it is don't have a diagnostic value, it has a prognostic value. Okay, so diagnostic value means it will not tell any name of the disease, the presence of any disease. Okay, so only the progression of the disease, whether it will disease will be increasing, or when you are taking the medicine it is coming to normal, it is decreasing, so like that it will tell. So this is very important. Okay, and factors affecting ESR. So ESR increased in newborns, in females, so pregnancy and menstruation. Pathological factors, ESR is increased in acute inflammation as tonsillitis. So tonsillitis if you have, so that time it will increase. So decreases in all type of anemia, it will decrease. So next coming to the hematocrit. Hematocrit is defined as it is the percentage by volume of packed RBC cells in a given sample of blood after centrifugation. So that means it is the percentage volume of blood that is contributed by red blood cells alone. So how we have to get this value? Hematocrit is same, PCV, packed cell volume. So both are same. Okay. So what you have to do is you have to take the blood. So take the blood mixed with the, okay, take the blood in a test tube. Take a blood in a test tube. Okay, so to here you have to fill the blood, then with the proper anticoagulant you have to put, then you have to centrifuge. So you know the centrifuge, it will run with the speed, okay, certain speed, 3000 rap it will spin. Okay, so while spinning what will happen? So all the RBCs will be settled down. Okay, so that is there are 3 layers will be formed. If you check the okay, so now you are taking the, I will tell the method. So take the blood in a test tube with the proper anticoagulant. So then you have to centrifuge. This is a centrifuge machine. Okay, so you have to keep here, you have to centrifuge. Okay, certain speed it will run for 30 minutes. After that you have to take the test tube and you have to see so what it looks. So okay, so above there is a layer, so clear liquid, so like a yellowish clear liquid will be formed, so that is called plasma. So that is a liquid portion will be separate, that is plasma. So below all the RBC cells will be present, okay, all the RBC cells are present. So RBC will be settled down, so RBC. So between plasma and RBC there is a another layer, so thin layer will be present, okay, thin layer will be present, so that contain WBC and platelets, okay, that contain WBC and platelets. Understood this one? So you can see the diagram as I told. So take the test tube. So when you fill the blood after 30 minutes, so what will happen? So above the plasma, so plasma is a clear layer, okay. So then below the RBC cells will be settled, okay. So between that there is a buffy coat, okay, buffy coat, which mainly contain blood cells, the white blood cells and platelets can be seen. So now understood, it is the percentage volume of blood that is contributed by RBC cell alone. So they will take only the measurement of this, how much the RBC get settled down. So that is will be represented as a percentage. So next we will see the normal value. The normal value of PCV will be varies with the age and sex of the individual. So that is gender. So in male it is 40 to 50%. Okay. So always ESR, when you are writing the normal, you have to write like 1 to 5 like that, millimeter. But in PCV it is in percentage, okay. So male it is 40 to 50% and female it is 37 to 47%. Next, which are the clinical condition where decrease in hematocrit, okay. So in anemia, because of RBC count is less, the hematocrit decreases, ESR increases, the opposite, okay, ESR and hematocrit are opposite. Then hyperaldosteronism, lower in females as less RBC count, okay, and in pregnancy. Increase in hematocrit, polycythemia is a condition where RBC count increases. At high altitude, low blood oxygen level, so hypoxia and lung or heart disease. So any two condition if you remember, so increase, decrease, it is enough. So understood? So hematocrit, it is the percentage of by volume of packed red cells in a given sample of blood after centrifugation. So PCV and hematocrit are same. So these are the significance. Measurement of hematocrit it will be accurate and most accurate and simplest for all the testing clinical hematology for dictating the anemia or polycythemia, and also very important for the determination of blood indices. So method, it is by Wintrow method. You can see the 3 layers after centrifugation. First one is the plasma clear layer, then a buffy coat, then RBC cells. Normal value 40 to 50% in male and female it is 37 to 47%. decrease in hematocrit, anemia, hyperaldosteronism, lower in females and pregnancy. Then increase hematocrit like polycythemia at high altitude, hypoxia, then lung or heart disease. So next, coming to the hematological indices. So there is a red blood cell indices or a blood test. It is a combined blood test that provide information about the average volume or size and hemoglobin content of the red blood cells. So that means, so these the tests are combinedly they are doing to check the volume and size of the red blood cells and hemoglobin percentage. So there are three tests are there. One is the MCV, okay, MCH and MCHC. So these are the formulas are there, okay. So mean corpuscular volume, MCV, understood. So mean corpuscular volume is the average volume of RBC, average volume. So much average volume of RBC is present in a given sample, understood. So they will see the RBC count, okay, we will see the RBC count and PCV, packed cell volume or hematocrit value. We need RBC and PCV values, okay. So next, this is the formula to calculate the MCV, mean corpuscular volume, that will give an average volume of RBC, that is PCV divided by RBC into 10 is the formula, okay. PCV into 10 divided by RBC. So if you give the PCV value, okay, so PCV of about 45, PCV is 45, then RBC count suppose 4.5, you have to multiply with the 10. So that value is your MCV. So nowadays, so if you give a blood to the machine, if you keep the blood into the machine sample, the machine only give all the values. There is no sitting and do the calculation and all. So that will give everything. RBC count is how much, WBC count, PCV, ESR. So everything in one, hemoglobin count, everything will be, it will give. Next one is the mean corpuscular hemoglobin. So it is the average amount of hemoglobin of a single RBC. The formula is hemoglobin divided by RBC into 10. Okay, hemoglobin divided by RBC into 10. Next is the mean corpuscular hemoglobin. So MCHC. So that will give the average concentration of hemoglobin per unit volume of RBC. Okay. So formula is hemoglobin divided by PCV into 100 gram. So one more is the color index. So color index will give the ratio of hemoglobin percentage and RBC percentage. Okay, it indicates the hemoglobin content in RBC. How much amount of hemoglobin is present in RBC is detected by formula color index. So formula is hemoglobin percentage divided by RBC percentage. So understood. So blood indices will give the average volume of blood, RBC and hemoglobin concentration. So by using MCV, MCH, MCHC, we can calculate or we can count the, we need hemoglobin count, RBC count and PCV values. Okay. So if you know all these values, you can easily see the MCV, MCHC and all. So color index, it is a amount of hemoglobin concentration in a single RBC, how much it is present. Okay, so that is formula, hemoglobin percentage divided by RBC percentage. So today class, what and all? So I will give summary. Okay, so hemoglobin disease you studied. Okay, so disease, there are two types of disease, that's thalassemia and sickle cell anemia you studied, right, today class. So next, coming to the ESR, right, ESR, erythrocyte sedimentation rate. So definition, normal value, which method. Okay, so then factors affecting, so why the ESR, the RBC settled down. Then clinical significance. Okay, clinical significance you have to study. Next, PCV or hematocrit. In PCV also, definition, normal value and factors affecting, means increase or decrease clinical condition, which method is important. So next is the blood indices. So in the blood indices, so there are three types of calculation is there, MCV, MCHC. So that and all you have to, and color index you have to study. Okay, this is a textbook, Manipal Manual of Physiology, C.N. Chandrasekhar. Okay, so that is for, you have to study this textbook. Okay, you have to, I am referring this textbook. Okay, so Manipal Manual of Physiology, C.N. Chandrasekhar. Okay, thank you all. I am ending the class. Okay.